Hi class. So this is a second installment for the muscles of the forearm. So this time we're gonna look at extensors. Extends the digits and extends the wrist at the carpal bones. So the flexors, all of the flexors connected to the medial epicondyle. Extensors connected to a lateral epicondyle. And again, everything is judged from the anatomical position. So the muscles that we're gonna look at is the extensor carpi radialis longus, extensor carpi radialis brevis. Longus is the longest and the brevis is the shortest. And extensor digitorium muscle and extensor carpi ulnaris muscle. So there's one muscle on the ulnar side and two muscles on the radial side. One is the longus and another is the brevis, and right in the middle is the extensor digitorium. Then also there's inside a deeper muscle is the extensor digi minimi. So the first one is extensor carpi radialis longus muscle. So it's connected to a second metacarpal bone. So this muscle is responsible for lateral abduction. So this is the lateral abduction and this is the extension. So the second muscle is extensor carpi radialis brevis. So this one is connected to a proximal part of a third metacarpal. But both of those muscles, longus and the brevis, are also responsible for lateral abduction. So now you can see these two muscles that are activated. So extensor carpi radialis brevis and this one extensor carpi radialis longus. The third muscle is extensor digitorium muscle and it's connected to the digits. It's connected to a distal phalange. But then there's underneath of the extensor digitorium, there's extensor indicis muscle. And it is inserted similar to a profundus on the flexor side. So this muscle also helps to abduct the digits. So after the flexion, this extensor digitorium helps to return the digits back to that extending position, and also helps with wrist extension and hyperextension. So another muscle on the opposite side is the extensor carpi ulnaris muscle. So in the ulnaris muscle connected to fifth metacarpal. So the extensor carpi ulnaris helps to adduct the wrist towards the midline, and it also helps with the wrist extension as well. So basically the tendons run down to the base of the middle phalanges where they flatten out and spread into the extensor expansion to each digit, to each finger. So the extension happens due to lumbricals and interosseous, like these muscles. So there's another muscle, extensor digiti minimi. So this muscle tendons are inserted into distal phalanx and the middle phalanx. So this is extensor indicis, the index finger, and this one is the extensor digiti minimi. So there's another muscle is called anconeus. So the anconeus muscle assists in the extension of the elbow, of the olecranon. So underneath that muscle, there is another muscle is called supinator. So as the name implies, it's responsible for supination. So now let's go a little bit deeper. So here we have extensor pollicis brevis and abductor pollicis longus. Abductor pollicis longus inserted into the first metacarpal. Abductor, right? Abductor pollicis longus. And then there's another muscle, extensor pollicis brevis. So this one is abductor pollicis longus and this one is extensor pollicis brevis. So basically abductor pollicis longus and extensor pollicis brevis, they work together. So abductor pollicis longus abducts the thumb in the radial direction. So when we look at this two tendons right here at the extensor pollicis brevis, and the extensor pollicis longus right here within this area. So in between these two tendons, there is a depression right between these two tendons. So it's anatomical snuff box. This was terminology invented in 1800s. So the scaphoid carpal forms the floor of the snuff box. So and this muscle, there's a group of muscles, we'll call them like thenar muscles. So let's recap. Extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum muscle, extensor carpi ulnaris, so it's like abductor pollicis longus, extensor pollicis brevis, and then extensor pollicis longus. And there's extensor indicis muscle. So these are the all extensors that we need to look at. So and with this I will conclude the second installment of the forearm muscles extensors.